Good morning, everybody. I'm Christine Felicetti, and I'm the Family Support Coordinator with the Pennsylvania Family Support Team based at the Center for Schools and Communities, and I'll be your moderator for today. It's my pleasure to welcome you to today's webinar, and our session is focused on collaborating for prevention, how children and youth agencies and family support programs work together. And I'm going to hand it over to Rachel.
Thank you, Christine. So, our topic today is collaborating for prevention, how children and youth agencies and family support programs work together. And we are so excited about the panel that has been assembled for this learning opportunity, which I'm going to tell you about in just a second. But we really wanted to focus on this topic in part because as you will hear from our panelists, how child welfare operates in different counties is different in Pennsylvania, but we wanted to bring together some examples to think about best practices of how programs like yours, whether they be home visiting or other types of family support programs, how you can create a strong relationship to think about how you can work with children and youth, not only with shared families, but also on prevention topics. So we really appreciate that you're here today. So I am not going to do much of an introduction to our panelists because they are going to introduce themselves in just a second. But just so that you know, we are excited to have Natalie Bates from the Department of Human Services, the Pennsylvania Office of Children, Youth, and Families. We are also welcoming Ashley Bishop from Cumberland County Children and Youth Services. Ashley Mensch, who is the director of the Columbia County Family Center, and Felicia Matricino, who is the parent ambassador from the Pennsylvania Child Welfare Resource Center. So I am actually going to turn it over, and I'll go back for a second. And if we want to just introduce yourselves in order and talk a little bit about how you sort of fit into this system that we're talking about today. So we'll get started with Natalie.
Sure. Good morning, everyone. Again, my name is Natalie Bates. I am the Chief of Staff with the Office of Children, Youth, and Families, and we are the entity within the Department of Human Services that really has regulatory oversight for county children youth agencies, as well as a number of service providers, namely those who are providing foster care, who are providing residential treatment to children, also adoption services. And then our office also operates some of the state centers for delinquent youth. As part of our kind of oversight, we obviously also are heavily involved in funding for child welfare services, which is something that I will talk about today. But our office is really at the state level, the one with that high level oversight of many of the kind of child welfare services in Pennsylvania. We work closely with our county children youth agencies, but also many of our private providers as well. So I'm grateful to be able to be here today to share some information that hopefully you will all find helpful. So thank you.
Thank you, Natalie.
Believe I'm up next.
Go for it, Ashley.
I'm Ashley Bishop. I'm the Director of Ongoing Services here at Cumberland County Children and Youth. So I specifically oversee our in-home service area, which many of our families are working with providers such as yourselves. And in my role, I'm part of a team that develops the writing for our needs-based budget to be able to fund the services. And I also oversee our diversionary programs. So we specifically right now, we're focused on programs that can address truancy, but I'm involved in that process as well.
Hi, I'm Ashley Mensch, the director of the Columbia County Family Center. So I'm one of the providers for prevention programs in Columbia and Montour County. So we have been working very closely with Columbia County Children and Youth since 2007. And I would say probably since 2017 with Montour County Children and Youth Services. We provide the Parents as Teachers Home Visitation Program as our primary program. So we serve about 120 families in Columbia and Montour County. With that program, we also offer Triple P services, a variety of parenting classes, family reunification services, family group decision making, families in recovery. So basically, we work very closely with children and youth to identify what the biggest needs are in our community, and we try to locate some funding or figure out how we can work within children's youth need-based budget, special grants to provide those services for our community. So thank you.
Good morning, everyone. I am Felicia Matrosino. I serve as the parent ambassador with the Pennsylvania Child Welfare Resource Center. I might just say CWRC in the future. I work in the statewide quality improvement department, and CWRC is a collaborative effort between the University of Pittsburgh, the School of Social Work, the Department of Human Services, and the Pennsylvania Children and Youth Administrators. So CWRC works to support the state's child welfare system by providing training, technical assistance, support to counties across the state. And in my role is to ensure that the voice of parents and lived experience is intentionally embedded into that work and not just as an afterthought, but more as a partner in shaping the policy and practice. About a decade ago, I was personally navigating child and youth services with my daughter when she was about 3. In and out of home services, family group decision making was something that was big for us. And that lived experience now informs how I work alongside the professionals to improve prevention and engagement efforts statewide. We're at CWRC, we're working to move beyond the storytelling and toward authentic partnership and incorporating parents into the planning tables, the advisory groups, training development, quality improvement conversations, basically more than just me. My role is to help bridge that gap between families and systems so prevention efforts can be shaped by both professionals' expertise and lived experience expertise. Thank you.
Thank you all for introducing yourselves. So I'm sure all of us can realize how excited, why we're so excited for this panel. We have folks at all levels in this work. And so let's dig in. So our first question, I think is at the heart of what we are talking about today. So what does a great relationship, a great collaborative relationship look like? And what have you noticed that's worked well from your perspective for how community organizations can partner with children and youth as well as families? So what is, in your view, a good collaborative relationship look like? And I will open it up, and whoever would like to go first can share.
I can go first. So as I said, we are one of the providers in our community for prevention services, and we have a longstanding relationship with our children and youth, which, again, that relationship has developed over many years. It was not an easy relationship at first because good relationships take work, just like in our personal life. So my biggest recommendation and things that I've seen that work well are making sure that you make the effort to reach out to children and youth services in the counties that you're serving. Let them know you're there, what services you're providing, how you fit into preventing child abuse and neglect. And just, first of all, just again, let them know that you're there. The other thing is talking with them about needs they have, what they're seeing in the community. One of the needs that recently was brought to our attention is that we needed more in-home support for families of parents who had school-aged children. Our community has a variety of early childhood programs, such as Parents as Teachers, Head Start, Nurse Family Partnership. But when children got into the school system, that support kind of died off or just wasn't as intense as what the early childhood services were. So that's kind of what led us to writing a Children's Trust Fund grant for the Triple P program 3 years ago. I will say that frequent contact with children and youth is key as well, because they're working with a lot of community partners. They're very busy. So identifying a time frame or a schedule that you're going to meet. I meet with our services once a month. It's a little easier for me because we're co-located, but at least quarterly meetings, like getting together, talking with supervisors, the administrator, directors of services, just to keep them up to date and get their perspective on, again, needs and how services are going. I'll stop there for now because I'm going to let other people jump in.
Thanks, Ashley.
I can share from our county perspective. I would second a lot of what Ashley said, in that regular communication is key. We often encourage our caseworkers to be doing home visits with service providers so that you're getting the same information and showing the family that you're, working together. But also regular communication outside of that. Our workers are there typically once a month, where service providers are in the home much more often. And so we really take their experience and what they're noticing with the family with a lot of weight. And we also have, I think twice a year, meetings with all of our in-home service providers. Our in-home supervisors as well meet every month with a different provider, just to continue to expand that connection and understanding of what services are being provided, and just bolster that communication and relationship.
I can go. From a parent perspective, prevention seems to begin more like long before the report is ever made, right? When families feel safe asking for help. A strong collaborative relationship between community-based organizations and children and youth, when it feels aligned, transparent, family-centered, feels more like one team versus all the silos. What I've seen work well, clear voluntary pathways to support that feels less like surveillance, transparency about roles, especially around anything like mandated reporting and stuff like that. Early access to concrete supports like housing, utilities, childcare, transportation, these things, the lower the stress, it helps to the prevention rate go higher. Sorry, I lost my words there. Clear communication so families aren't retelling traumatic experiences. I've learned that warm handoffs instead of cold referrals are so awesome. They feel normal and sorry, the dog's in the background. It feels a little more real and authentic when it's a warm handoff. And I feel like true collaboration really goes beyond coordination. Coordination might send a referral but collaboration of like the goals and accountabilities and respect. I feel like that shared accountability helps keep families strong.
Felicia, I think you hit on that perfectly and made me think of some things that we do, like when you said about making sure that services are voluntary. So we try to we meet with all of the new children and youth caseworkers. So once a quarter, because there's often frequent turnover with caseworkers. So what we do is we set up an orientation once a quarter. I meet with the new caseworkers and go over all of our services, really highlight that the services should be voluntary, offering these services early on in this, in the stage of involvement. If a referral comes in, and you find that it's unfounded, still offer services to the families because we have this support in our community. Just again, really making sure the children and youth caseworkers have the verbiage to introduce parents as teachers or triple P or parenting classes, so that, they get the buy-in from the family, and it helps them say, like, I'm here to support you. I want to, provide you with services that eventually allow us to get out of your life, because really that's what families want to hear, right? They don't want to be involved in the system. So, and then I tell my staff from the beginning, like Felicia said, you have to identify that you're a mandated reporter, because sometimes, relationships, as we develop rapport, we can become a friend somewhat to the family, and sometimes they forget. So I always make sure that those roles are clear. If we know a family is involved with children and youth, we get a release and let the family know we are going to have regular communication, because we want to be working as a team. We want to know what the concerns are so that we can help the family rectify those concerns, and build their supports and build their knowledge. And then again, that frequent communication, we share staff directories. So anytime there's staff changes, we will exchange staff directories so that my staff have contacts for children and youth, and vice versa. So that, even though we're not meeting in person all the time, we are communicating via email or phone.
So I just wanted to hop in and ask a quick question, and then Natalie, but related to what Ashley is talking about right now. It seems like that collaborative effort is really coordinated in Columbia County. How did you get there? I guess, because I think there might be some folks, at different levels of their collaboration with children and youth. And like, it sounds so integrated. Like what caught my attention was like, we shared staff lists, like that level of like coordination. You can tell that you're really, trying to work together. Like, I guess you don't have to go through the whole, like, how did it happen? But like, I'm wondering how did you come to that?
Well, like I said, that didn't happen overnight, because our relationship started in 2007. And again, it started out with just, quarterly, then eventually monthly interactions where we were talking about services. And then it evolved in, like, let's talk about shared cases. And over time, when children and youth saw that, we could come in and kind of be the eyes in the home for the family, and maybe they didn't have to keep a case open. So they really saw the benefit. And I think that's the biggest thing. They need to know that you're there to support them. I always say to my staff, like, again, our job is to be there to support children and youth however we can, because they do provide us a lot of funding. But the goal is, our services are voluntary. It gets them out of the system. It keeps kids safer. So when you can get staff to understand, the children and youth staff to understand that, and they're connecting them to you, I guess the value and the relationship just grows from there. The relationships start over every time there's a new caseworker, right? It's a new process. We have to develop those relationships, but just like we do with the families, you have to use those same skills, like with rapport building, with the caseworkers. And again, it was just us going to children and youth over and over and over again. And I know when we were planning for this panel, Ashley Bishop, we were talking, and they're very busy with all their reporting. They are inundated by cases and families. So they're often, they want to seek out services, but don't always necessarily have the time to. So if you can come, make the effort to set up that meeting with them and get a regular schedule going, I think it just naturally evolves over time.
Thanks, Ashley. Natalie, did you want to share?
No, I was just going to say briefly, I think obviously at the state level, we're not involved in those relationships between the providers and the counties, but we do get to see a lot about the programming from where we sit. And I will say one of the things that sometimes we see when kind of a hallmark of what we see at our level when there's really good collaboration is also sort of um, the counties and the providers are really in tune, not just about we need these services, but how do we make them accessible to the family? So is it in home? Is it at a location? And if it's at a location, how do we get the family there? Do they need childcare? People are working. And so they creatively kind of work together to think about how do we create the best situation possible. So it's not just that we have the services, but that people can actually sort of easily access them in a way that, makes sense within people's lives. Because often families are dealing with a lot of different things and maybe a lot of different service providers too. So that's just from where we sit sometimes. And that's something that we see as kind of a sign of things are really working well when we see some of those things.
Thank you. Hi. Well, we appreciate that. And as a reminder, feel free to put questions in the chat. We will have a sort of Q&A at the end that we will check out some of those questions that you're putting in the chat. But as you think of them, feel free to put them in the chat. Okay, so our next question for the panel is, how can community programs and families work with children and youth on prevention work farther upstream before families have open cases? What does that look like? How can community-based organizations be involved with children and youth on prevention? How can children and youth support prevention efforts of those community-based programs? And in all those scenarios, how do we really ensure that there's authentic engagement and parent voice in family voice in this work? So I will open it to the panel, whoever would like to.
Okay, I can go first. Sorry. Oh, I apologize. Okay, I'll go. So I keep thinking about prevention, and I keep feeling like creating conditions where families actually feel safe asking for help. Community programs are often the first people that parents might come into contact with. I'm sorry, my son is home today in the background.
Today, this was me.
Yes.
Here.
So when those relationships are voluntary and transparent, supportive, families are more likely to reach out before the stress turns into a crisis. That early engagement creates the opportunity to reduce the stress through concrete supports that they may need, and provides the opportunity for honest communication, clarity, around the mandated reporting before they do, you know what I mean, start like divulging everything or as they are. Systems can connect families before crisis by paying attention to maybe some early stress signals, like how obviously some of the ones we are aware of, like housing instability, utility shutoffs, that kind of stuff, childcare gaps. They're prevention opportunities, not just risk factors. So when we respond to stress early, we reduce the likelihood of formal involvement maybe later. I feel like schools can play a huge, powerful prevention role when they see themselves not only as mandated reporters, but also as partners in stability and helping connect families to resources and to recognize that poverty is not neglect. I believe prevention must also be shaped by families themselves. Like we are working to have parent voice at multiple tables, the same thing. Having parent voice should not just simply come from strategies. It should help design them, right? Parents should help design them. Sitting at the table is important, but having influence at the table is really what creates the authentic partnership for them to have a voice. In my experience navigating the system, earlier access to voluntary support would have been a little bit better or would have made my outcome maybe not be involved. Clear collaboration between the systems, again, the siloing, the misunderstandings, the programs not aligning or having the same language. Prevention, that kind of perspective shapes how I think about prevention today. Gosh. when prevention efforts are built with families, not just for them, they're stronger, more responsive, maybe more sustainable. I know that the national birth parent networks are starting to work on mandated reporting with schools and like how that works and kind of seeing where that can help prevention and educating the staff. So I'll pause. I don't want to keep going.
Thank you, Felicia. No, that was really great. I loved what you said about they're not just stressors, they're prevention opportunities, right? And thinking about that in connection, with the idea that our work is meant to be strengths based, right? So that idea of thinking about stressors as a prevention opportunity, like it automatically puts you in the perspective of also thinking like what is strong in this family that we maybe can leverage to support that prevention opportunity. I was like, when you said that, I was like, ooh, light bulb. I love that. Okay. Anyone else on the panel like to answer that?
Yeah, I would second everything that Felicia was sharing and emphasize. I think our partnership with school districts has been huge in being able to offer preventative services. We have quarterly meetings with all of our districts, which I don't know that most counties do. But we utilize that as an opportunity to share community programs that we're aware of. There are some services that we fund and are diversionary, and that schools can refer directly to the provider, and we will fund it without having to be involved. And we'd love to see that effort grow. I think that child welfare can often be reactive. And so the opportunities to be preventative and to partner within our community to avoid referrals to us ideally, but more importantly, avoid abuse and neglect towards children. So.
And I'll add on to that again, what Felicia and Ashley said are spot on. I will also say that things that we do to develop relationships to get prevention services out there before maybe a family is involved with children and youth is, attending community events. So we were out trying to go to any places that families are. So, for instance, we get invited to National Night Out, Ag Day, things like that, to get ourselves out there. So again, hopefully we're providing support to families before they get involved into the children and youth system. And I'm going to go back to partnering with children and youth. We try to include them on as many of our projects and activities as we can. Again, showing that, this is what our services entails. This is what we're offering to families. So every summer we have a roll and read. We offer children and youth the opportunity to come and set up a booth and read to the children. Because again, we want families to know that yes, children and youth can be scary, but mostly they are there and want to support your family. They want to see your family healthy, safe. So again, we try to help them kind of get a more positive view in our community. Other things, we have a mobile dental clinic. So we have a clinic that comes to help children get dental services because we know that's a big need in our community. So we always send our flyers to children and youth because we know they're working with families who may have that need too. So again, that's another way of building that relationship and allowing them to see what we're offering to the families and the value in partnering with us. So just wanted to throw out there that anytime you can work together in the community or on projects, it's very beneficial as well.
I was just going to build off of kind of what Ashley talked about with the schools, because that is such a critical piece of the puzzle too. Obviously, our office operates the 24-hour child abuse hotline, Childline. And so when we look at the data, by far, most of the calls that we get don't meet the definition, aren't child abuse under the law. There are this other set of concerns about housing, mental health, truancy, things like that. And most of the reporters, our largest sort of population of reporters, are the schools. They're the ones who interact with the children every day. And a lot of times they're just looking for, what do I do? How do I help this family? And a lot of times that gets routed to the County Children and Youth Agency. And so we talk a lot about, especially at the state level, how do we build those, help support those networks at the local level so that people have those resources. So it doesn't always have to be a call to children and youth. There may be other services in the community. People just don't know how to access them or where to go. And so that's a big part when we talk about prevention. We kind of look at those pathways, which I'm not sharing anything people probably don't already know or experience, but because Ashley, you talked about that relationship with the school, I just wanted to reinforce that because we see that too at the state level, how important that is.
Thank you. So thank you for sharing about this idea of, working together on prevention farther upstream. And, I think all of you are talking about ways that just that consistent communication and collaboration sort of feeds into this, right? Like, Ashley, you were talking about, Ashley Minch, you were talking about like inviting children and youth to the roll and read, which is a great example. And Ashley Bishop, you were kind of talking about like diversionary programs and what does that look like. So I appreciate you connecting those things. One of the things that I wanted to, and I'll put a link in the chat, is we're in March, and we intentionally did this session in March in part because many of you might be preparing to recognize Child Abuse and Neglect Prevention Month that happens in April, and there are some great prevention centered activities that you can do during April, and then invite make sure that you're inviting your children and youth agencies, or maybe you're already connected with them and doing planning together. So I'm going to share a link in the chat from the Pennsylvania Family Support Alliance, who has some events coming up in April. It'll also be in our news brief that's coming out in April as well, but I'll share that link here. And one of the activities is painting for prevention. And some of you on this call or on this webinar may have already participated in painting for prevention events, but that's an example of how communities can really come together and think about getting the word out about the well-being and supporting families, which I think is where a lot of Felicia's comments were coming from, because it's about supporting families as far upstream as possible before the crisis occurs. Okay. All right. Well, we are moving right along in our panel. Definitely keep putting items, any questions you have in the chat, but we're gonna go with we saved the funding question for last. So I think Natalie is going to get us started with this question of thinking about what kinds of funding are available for prevention work through the Pennsylvania Office of Children and Youth and through county children and youth agencies. And she'll get us started talking about some of the funding sources and sort of where they come from. And then the rest of the panel can also chime in about some of the work that they're doing and how they've, worked with county children and youth agencies to have those funds to do this work. So Natalie, I'll pass it over to you, and I'm going to stop sharing because I believe you want to share your screen, right? Okay.
Yeah. So thank you. So yes, child welfare funding is very complex. So I'm going to try to hit a few highlights, and especially related to prevention, because there's a lot to it. I did put together a document. This is all information from different public sources, including some information that's in our needs-based plan and budget bulletin that we put out every year for the counties that gives them on instructions on how to submit their budgets to us. But in Pennsylvania, it's a mix of federal, state, and county funding. And traditionally, while I think everyone has known how important prevention is, the federal funding streams haven't always necessarily been aligned to support that. But the document that I provided and shared, it does highlight, again, some key federal funding and state funding sources connected to prevention. It's not completely exhaustive of all funding sources. There's a whole funding stream for older youth services that isn't reflected in there, but these are some of the pieces that tie into prevention. And so at the federal level, the OCYF, our office, is sort of a pass-through of those federal funds to work to get those to the counties. But the two of the main programs are under the Social Security Act, and that's Title 4B and Title 4E. So Title 4B was traditionally more of the prevention-focused funds that we really got from the federal level that we could have to support counties. And so a lot of that is around really reunification, family preservation, some of those types of things. But when we talk about Title 4E, Title 4E was traditionally, I'm sorry, I'm scrolling everywhere. Title 4E was traditionally at the federal level, the funds that went to states to support children who were in placement. And if they met certain eligibility criteria, then the state could request federal reimbursement to support those placement services. But several years ago now, probably close to a decade, the federal government finally kind of caught up with where everyone else was at and said, you know, instead of investing all this money on the back end when kids have to go into care, wouldn't it be great if we actually put a little bit more money up front to support prevention? So I think most people have heard of the Family First Prevention Services Act. I believe that was passed in 2016. And that was really, in essence, a bill that looks at shifting funding in child welfare at the federal level. And what they kind of did for the first time is this Title 4E funding stream. They allowed states to actually be able to access some of that money for prevention services. Now, the feds did put a lot of parameters around that. So their children have to sort of be identified as significant risk of placement. There are certain programs that the feds have approved that states can possibly get reimbursement for, and states have to make a decision about what programs they want to include in their federal plan to then be approved to access that funding. But they also extended the ability to be able to use some of that funding to also pay for caregivers, getting some of these services as well, and also focused on pregnant and parenting youth in foster care, also using some of this funding to support them. And so they have these categories of mental health services, substance abuse, and in-home parent skill-based evidence programs that they put on a federal clearinghouse that states can consider. So in Pennsylvania, we did decide to opt in to this program. It is voluntary. States don't have to do this. And we identified a number of evidence-based programs. I believe we have 8 or 9. But we looked at a lot of programs that were already operating in Pennsylvania, in which we were putting a lot of state and county funds into to start out with in terms of being part of this program. So things like Parents as Teachers, multi-systemic therapy, functional family therapy, triple P. I'm happy to share a link where you can see that listing. But those were sort of the programs we started out with. We can amend our plan and add programs along the way. We also have to make sure that as a state, the programs that we are claiming for, 50% of them have 50% of sort of the claims we make to the feds for funding reimbursement have to be for well-supported programs or the highest tier programs at a minimum. So we always have to make sure that we're balancing in terms of thinking about what programs we might want to bring into Pennsylvania to put on this plan specifically. We have to make sure that we're balancing that the utilization is at least half of it is being drawn down from these kind of highest tiered, well-supported programs. For programs that are rated sort of promising or supported, if we choose to have those as part of our approved plan, we also have to have what they call a rigorous evaluation component to it. So if we're going to claim money, we also have to have a whole structure in place to do a evaluation of that. And our Child Welfare Resource Center partners have been very great in helping to support some of the evaluation efforts we're doing on some of the programs in our current plan. One of the things that the Family First, a Title IV prevention program also allows for is this opportunity to think a little bit creatively about how we can try to get the funding more upstream. So not just for families who are open and receiving services through the County Children and Youth Agency, but sort of a way to get the money into the hands of those who could get to those children earlier. So the feds did sort of reinterpret Family First to some degree a couple years after it had first been passed. And a lot of states kind of looked at this reinterpretation and created models to get more to primary prevention. In Pennsylvania, we call our approach a community pathway. So that is where a county can work with providers to look at how they can potentially serve some families who maybe aren't open with the child welfare agency, but clearly probably would be if they didn't receive one of these prevention services. And that's a way to sort of extend access to some of that federal funding a little bit further upstream. We do have one county who was approved for a community pathway in Pennsylvania. They are currently not operating that model yet, but it does. One of the issues that we've discovered is there's a lot of challenges with the federal requirements. So even though these families aren't involved with the County Children Youth Agency necessarily, the feds still want to see some sort of risk and safety assessment process that's going on with these families, as well as there's the need to develop a prevention plan, work through sort of all of the billing, all those kinds of things. So it is a challenge to access the community pathway model. However, given that we're about 10 years into Family First and we've learned a lot, and we're also connected nationally, we're definitely taking a look to see if we can revisit and negotiate some of the initial terms that the feds approved for our community pathway to see if we can make it a little bit less burdensome for people to access that. We've definitely had some folks approach us to think about it. But again, I think one of the hardest pieces is that kind of administering risk and safety assessment to families who aren't involved in child welfare, and providers taking that on is a little bit of a barrier to people kind of wanting to go that route. But it is something that we continue to sort of assess and see if we can renegotiate with the feds to make it easier. So Family First has been pretty significant for us here in Pennsylvania, and we continue to look at whether there's opportunities to add additional programs to our plan. I will say it usually takes at least a year for the feds to approve your plan if you make changes to it, so it's not fast. But at the state level, we look directly to the counties for recommendations on programs that we should consider to add. And we also look at claiming from the budget and funding to help us see if there's programs on the clearinghouse that we're drawing down a lot of state and kind of county funds for that would make sense to try to work to draw down federal dollars for. We don't work with providers directly since they're the ones who contract with the counties, and we really want the counties and providers to work together to lift up to the state to say, hey, these are some programs that we think would be good. But I've got a lot of providers in Pennsylvania, and so we want to make sure that if we're identifying programs at the state level to use, that the counties feel that those programs are going to be beneficial and meet their needs. So that's why we kind of work through the counties to identify those programs. So if people have more questions about Family First, I can certainly try to answer those. Just a couple other funding streams. I did note things like TANF and Medicaid. A lot of times when people think of temporary assistance for needy families, they think of sort of cash assistance, direct cash payments to families. States actually do have a percentage of those funds that they can use towards child welfare. Medicaid, certainly that's important for a lot of our kids in foster care. But we were fortunate enough about a year and a half ago to be able to get a medical director at the state level within the Office of Children, Youth, and Families. And so they are really working closely, looking at things like EPSDT and some of those other things through Medicaid that also can have a prevention component. And then there are some other things like the Child Abuse Prevention Treatment Act. This isn't money that actually flows from OCYF to counties. Often this is a federal funds that we use to support activities like training. And sometimes we will issue grants around different things related to certain needs or areas that we're working on. But that's sort of another source of funding, as well as the community-based child abuse prevention dollars, which OCDEL has helped us administer those funds. And then state funding for child welfare. There's a really crazy looking chart. It was the best way I could think to summarize what state dollars might look like. But when we say Act 148 funds, if you hear people use that term, all that means is that's the state, that's the flat state funds that come from the state to the county out of the state budget. And there's a whole interesting algorithm in the Pennsylvania Human Services Code that lays out what some of the different categories are for services and what's the percentage of reimbursement from the state. So for adoption services, it's 100% reimbursement to the county. For those services from the state, if you talk about juvenile detention, that's a 50% reimbursement. And so that's just to give you an idea of some of the different sort of funding categories that are actually linked to the state dollars. And then I did provide information about special grants, which I know Ashley had talked about, and some of you may be familiar with. It might be what you're most familiar with in working with counties. And that's really where we have the opportunity to grow and help support evidence-based programs. I will say that Family First is not a funding source that's great to help get a program off the ground, because the reimbursement only works through invoicing for the service for that child. So there's not like a lump sum you can get for startup money out of Family First to sort of get the program off the ground. When it passed, the feds gave states a little bit of money to do that, but we've spent that. So the special grants just lays out the different categories. We have housing. The ATP is alternative to truancy program. It shows you what the reimbursement rate is and what some of the just brief descriptions of what those different categories are. But for evidence-based programs, pretty much counties can put as many different evidence-based programs as they want in their special grants. They just have to provide the justification, and it has to be linked to a reputable kind of clearinghouse. There again has to be that evidence behind it, but we do have also the promising practices, which are sort of to give counties some room to work with providers to do more locally grown programs. And then housing is also an important one because we know that's just such a critical concrete support for our families. So I went through that as fast as I could. Hopefully I didn't make it too confusing. It's confusing enough for everyone who's in it. But I'm certainly happy to answer questions. And again, I just tried to pull some of that information to summarize some of those sort of key funding sources for you.
Thank you, Natalie. I really appreciate that. It's great to have things in one spot. And I would be remiss if I didn't mention also, and we talked about this in our planning meeting, and Ashley mentioned that they were a Children's Trust Fund grantee, which is another source of funding in Pennsylvania for prevention, primary and secondary prevention before the first instance of child abuse and neglect occurs. And the CTF board had just had an RFA that was out. It just recently closed. And so definitely that is a place to think about, especially if you are looking to start something that is maybe a little bit more innovative or locally grown. You can always be looking at those requests for applications that come out from the Children's Trust Fund as they come out. So, and I can put the link to the Children's Trust Fund website in as well. And that works kind of more through Octel than through OCYF. So, which is why Natalie didn't have it on her sheet.
Yeah, and also the Pennsylvania Commission on Crime and Delinquency does a lot of grant opportunities that are prevention in nature. There are also some, honestly, funds we work with them to funnel out around prevention as well, even related to things like human trafficking, things like that. So there's a lot of different funding sources out there. So again, this isn't entirely comprehensive, but the Children's Trust Fund, PCCD, there's a lot of different opportunities as well that the state's able to offer to put some funding out.
Great. Thank you. So we are getting close to the end of our time. So if you do have questions for the panel, please be sure. I think there were 2 questions that were in the chat that Ashley Mensch went ahead and answered. So excellent. But if anyone else has any questions, go ahead and put them in the chat now. But I want to give the rest of the panel a chance to answer this question about funding or share any perspectives they have about this.
Rachel, this is Paul.
Hi,
Not
Paul.
a member. How are you? Good. Not a member of the panel, but for those of you who don't know, I'm Paul DiLorenzo. I chair the Children's Trust Fund Board, and good to see all of you. And so exciting that this work continues on. I do want to mention, just give the trust fund just one more plug. The board of the trust fund, most of whom are new members, we all talked a lot about how the existing RFA and some of the other parameters around the trust fund in some ways was discouraging for people to apply. And we took that seriously, trying to figure out how we could best open the door wider. The board members spent a lot of time working along with Octel and procurement and legal to come up with an easier version of the RFA. We didn't get everything we wanted because, you just can't do all the things you wanted at the same time. But we made some significant changes that now makes it a little easier to go after those grants and to apply for the dollars. We're thinking, though, that the legislation for the trust fund that enabled it in 1988 is a little outdated. There have been some minor changes over the years, but we really need to have a fresh approach. And so that's where the board is at this point, looking at how the trust fund can support not only prevention programs, but maybe even farther upstream family support and engagement programming.
Thank you so much, Paul, for sharing that. Anyone else have anything? Anyone on the panel, if you'd like to share anything? I'm not seeing any questions in the chat. Although I will say the one question that Ashley did answer specifically about Columbia County children and youth, I think is something that many folks might be talking about related to children and youth agencies being understaffed. Are there any initiatives at the state level to support that?
Sorry, I was trying to come off mute. So workforce has been, it's sort of one of the main pillars of everything, right? If you don't have the workforce, you really can't get far with anything. So we did, I want to say back in July of 2025, we worked with one of our vendors to do a pretty comprehensive report. The counties were great partners in letting them access staff to really learn about what are we seeing in the counties. And I always say one of the things we always stress to publicly in talking about that is it's a little bit crazy that caseworkers, a lot of them have 2 or 3 jobs just to support basic living on top of trying to be a caseworker, right? So there's a lot of issues in terms of pay, the trauma that comes with the work, all those sorts of things. So it was a comprehensive report with a number of recommendations. And then from that came a work group that's chaired by one of our staff, and then Brian Borman, who's the head of the Pennsylvania County Children Youth Administrators Association. And we have a lot of county participation in that group. And so we have been looking at what are some of the sort of large scale things we'd like to try to advance, but then also working at a very granular level with counties, looking at what has worked for some of them, what's successful, what additional supports do they need. So we're kind of working at both of those levels to create tools, resources, look at ways that we can better support the workforce, because again, it's critical. You don't get far if you don't have the right people, in the right positions to do this critical, valuable work.
Thank you, Natalie. I really appreciate it. So I know there's a question in the chat, and if our panel has a few minutes to stay on, maybe we could answer that question. It's a wonderful question. But I do want to, before we go that, I want to make sure everyone gets this information before we hop off. We do want to make sure that you take our survey, and I'm going to put that link in the evaluation link in the chat. It will also come out in the webinar acknowledgement. So be on the lookout for that, so that you can get that evaluation and complete it. And I'm putting that in the chat right now. And also our next webinar is it's a date change. It's going to be on April 15th, and it says stay tuned for the topic, but breaking news, I have the topic. We just confirmed that we are going to be hearing from the Bester Community of Hope from Hagerstown, Maryland, and how they've designed a neighborhood-based service strategy that has led to authentic family engagement and a changed community impression of how agencies work with families in their communities. So we're really excited to be welcoming the CEO on April 15th, and information with that invitation will be coming out soon. So I just wanted to say that out loud. And there is, if we have a chance, and you are, and any of the panelists would like to answer this question that came in, how do we as parent educators let parents know that CYS is here to help and not just take families out of homes? And I see Felicia responded in the chat. Go ahead, Ashley.
I was going to say, I can answer that a little bit. So one of the things that I encourage my staff to do is, when you make your first contact with the family, or the first time that children and youth is involved, is to really work with the family to allow them, or to get them comfortable with you getting a release signed with children and youth. Some families are scared to sign a release because they are afraid you're going to see something and report it. But we really try to, come from a strength-based approach and say, I see wonderful things in your home, or I want to share the wonderful things that I'm seeing. Yes, I am a mandated reporter, but there's a lot of great things. And children and youth, I know a lot of people feel that they're there, they want to take your children, but really they don't. So again, getting that communication. And then once you have that communication, we do a lot of joint visits with children and youth. So we will ask the family's permission and say, on my next visit, would it be okay if your caseworker came to our visit and we talked about some of the concerns, and I can share some of the things we've worked on and how I can support you, so that we can, again, get out of working in silos, like Felicia said, that we are all on the same team. And I think, in most scenarios, if you can get the family to see that you're all working together and, they have a good rapport with you, they trust you, that bringing children and youth in, and it also changes children and youth's view of the family a lot of times, when they can see that all the positive things that you as home visitors are working through with the family, or, there are concerns, but you're connecting them to resources, and this is our plan. So that's one suggestion that I have.
Thank you, Ashley. And Felicia, what you added to the chat, I think is so important. This idea of transparency, yeah, and framing concerns as partnership. This is absolutely that you have a role in this work, and it may be different directly than children and youth, but that transparency and something you said earlier, Felicia, too, about like being on the same page, showing that it's that you are talking together, and it isn't like, you mentioned something about families needing to like retell traumatic events and things like that in itself. Yeah, like thinking about those things so that we can support families through this process is ultimately what is helpful. So, all right. Well, I do really want to thank this rock star panel. We are so excited that you were able to join us today and share about your experiences. And lots of folks in the chat mentioning that this has been helpful. So again, I really appreciate you being here today and being a part of the panel. And thanks everyone for hanging in for a few extra minutes to get that really great question discussed. And you will see the evaluation coming up. And remember, if any of your colleagues were not able to watch today, on the Family Support webpage, there will be a link to this webinar, and that'll go out as well with the acknowledgments of attendance. So thank you again, everyone. Have a wonderful rest of your day.